EKG presentation by Aubrey Foreman. So we're going to talk about premature atrial complexes. So what exactly is a premature atrial complex? A premature atrial complex can also be known as a premature atrial contraction. This tends to occur because the unexpected area in the atrium fires an electrical signal that triggers a heartbeat. This creates an extra heartbeat that is not a part of the actual heart rhythm, which tends to throw off the normal heart rhythm for a small period of time. With a normal heart rhythm, these electrical signals start at the SA node, but with a premature atrial contraction, the electrical signals does not start at the SA node, but it tends to start at an area of the pulmonary veins. Since the electrical signals is firing here unexpectedly, that is what creates an extra heartbeat, which throws off the normal heart rhythm temporarily. And we'll go over EKG rhythm strips that will show us this. So this is going to be our first EKG rhythm strip. So this is an EKG rhythm strip that contains 4 premature atrial complexes. So if you can see with the arrow, you have 1 premature atrial complex, you got the second, you got the third one, and you got the fourth one. So when you look, you can see an abnormal P wave on the EKG strip because of the premature atrial complexes that are occurring. So let's have a look. So right here you have an abnormal P wave, and keep in mind where these arrows are pointing, this is where the premature atrial complexes are. So abnormal P wave, you got another one, and then another one, all following. So then, if you notice, after the premature atrial complexes, you have a little bit longer of a pause. So right here, you got a pause, you got a pause, you got a pause, and you got another pause. Now, this right here is the SA node. So this is the normal heart rhythm, the SA node rhythm. So you notice that after this, there's not as long of a pause. So SA node with like QRS complex, normal, then you got that abnormal P wave, and then you got the premature atrial complexes with the pause. So after this, you will have a pause before the SA node beat. So you have a pause and then SA node beat with a QRS. So how to recognize the rhythm. So the rate. Premature atrial complexes can occur at any rate. Regularity. Heart rhythms are regular but can be interrupted by the premature atrial complexes like we saw on the EKG strip. The P wave. The premature waves associated with premature atrial complexes may look different in appearance from a sinus P wave, which is what we just saw. They can sometimes be hidden with the T wave altering its shape. A sudden change in the T wave shape could indicate a hidden P wave. Normally, the T waves and QRS complexes will have a constant shape. If one T wave appears unusual, it may be hiding in a P wave. So the interval. The PR interval is from 0.12 to 0.2 seconds, with the QRS being less than 0.12 seconds, which both the PR and the QRS being in a normal range. So a non-conductive premature atrial complex. A non-conductive premature atrial complex is just like a premature atrial complex, except when the PAX is not followed by a QRS complex. This is when it is considered a non-conductive premature atrial complex. This happens when the PAX is very premature and the electrical signals will not be conducted to the ventricles because it will arrive to the ventricles during its refractory period. When the QRS is absent and you have a pause on the EKG, this is most likely because of the non-conducted premature atrial complex. When you see this, be careful not to call this a sinus block or a sinus arrest. The best way to tell is to look at the T wave and make sure there's no P wave hiding within the T wave during this pause. So, non-conductive premature atrial complex. So, as you can see, in this example of the EKG rhythm strip, we have a normal sinus rhythm with a QRS, a normal sinus rhythm with a QRS, and then right here, we have an abnormal P wave with no QRS following it. So this right here is what's considered the non-conductive premature atrial complex. And then after that, it goes right back to a normal sinus rhythm all the way through. Premature atrial complexes. So what causes them? The reason premature atrial complexes occur is because the atria becomes hyper and fires an electrical signal before the sinus beat is due. Heart disease, hypoxia, tobacco, and some medications can cause the atria to become hyper. Premature atrial complexes can be considered normal if it does not occur often. So adverse effects. So what are the adverse effects of premature atrial complexes? So if premature atrial complexes does occur often, this can be a sign of a more serious impending condition like atrial fibrillation or atrial tachycardia. If PAX is only occurring occasionally, then there should be no adverse effects. Occasional premature atrial complexes are considered to be normal. So as long as they're not occurring often, they're considered to be normal, and there should not be any adverse effects that occur with a premature atrial complex. So treatment. So like we've been saying, treatment is usually not necessary for a premature atrial complex. But if treatment is needed, there are a few things that can be done. So the treatments could be to eliminate caffeine, tobacco, and other stimulants. You can also give calcium channel blockers or beta blockers to treat premature atrial complexes. All these things can reduce heart rate, which helps reduce atrial irritability, so premature atrial complexes do not occur. So this is a reference page right here. And then if you go to this link, it'll send you to the first sinus rhythm EKG strip. And then the other one I got of the non-conducted premature atrial complex, I got that from the book. And you can see right here, here's the reference page for it. But if you have any questions, just reach out and let me know. Thank you.